Item, the agenda item is to provide an update on the employee medical insurance. Human Resource Director Lyman Lockett will present.
Good evening, Mayor, Council. Can you hear me? Doesn't sound like it's on.
No, it doesn't sound like it is.
Yeah, I think. Up. It's up.
Well, that's the way to start the new year, isn't it? Okay. We have a microphone problem here. Some help?
Okay.
Is that it?
How's that?
Good.
Good evening, Mayor and Council. Here this evening to give you an update on our employee medical insurance, and I'll just walk through a brief agenda. I'm going to spend some time over the next course of an hour. We'll talk about the market conditions. I'm going to introduce our new broker. Want to spend a little bit of time talking about our RFP process to secure a new broker consultant. Just give you a quick refresher on our current plan options. We'll talk about our loss run experience. I want to give you an update on the wellness clinic and how that's performing. And we will also cover wellness initiatives, cost containment strategies, and most importantly, we'll look at our options to move forward, and then we'll give you the next steps that we have planned. We went through an RFP process, and we finalized that back in October of 2013 to secure a new insurance broker. And through that process, we were looking at a number of things. One of the things that we wanted was a broker consultant that had the expertise to coordinate all aspects of our employee health care. That includes our clinic, which is a major part of it, great employee benefit, and to look at ways that we could better integrate that clinic. We wanted someone that would best assist us in our negotiation with the providers, the insurance providers. We were looking specifically at someone with underwriting experience. And someone who could look at the things that we have. We've got some great things in place already with our healthcare clinic, with our relationships with some of our other providers, and leverage those things in the best interest of the city. Through that process, we ended up selecting the Levitt Group. Rick Shuckero, and I'll talk about him briefly and then give him an opportunity to talk a little bit about himself. Rick is with the Levitt Group. The Levitt Group is the third largest privately held insurance brokerage firm. Rick is here locally, which was one of the other things that we were looking at. We wanted a broker that was local. Based on our past experience, we needed someone who was more participative in the things that we were doing. So we wanted someone local. And we wanted someone with expertise in the insurance field. Rick has 9 years of experience as an underwriter. He has 9 years with Cigna. With Cigna, he was the vice president of marketing and the vice president of underwriting, for Cigna. Some of his larger accounts included the city of Phoenix, Maricopa County, state of Arizona, all 3 state universities. He also has experience with United Healthcare, the Healthcare Partners, and Samaritan Health Plan. So extensive experience. I'll let Rick talk a little bit more about his experience, but we felt he met the experience level and had the expertise we were looking for to move forward. So with that, I'll let Rick talk a little bit more about his experience.
Well, I'm really happy to be here, Mayor and Council, and it's a great opportunity to be in front of you and answer any questions. Hope you get ask questions as we go through the presentation.
Thank you.
It's usually the best way to get this because it's really your time. I could talk for days on healthcare reform and what happens inside these insurance companies, and so we want to just make sure we hit the right points with you. I'm from Hartford, Connecticut, which is the insurance capital. Mm-hmm. We're kind of genetically engineered to do insurance back there, and then they sent us out into the world. So you either become an actuary or an underwriter. If you can't pass the 10 actuary exams, you become an underwriter, which is what I did. So I ran the east half of the country for Cigna and then the west half. And we moved out to Phoenix 23 years ago to set up the whole western region in Phoenix because it's the best place to live in this area.
Yeah,
So.
it sets up everybody's retirement, doesn't it? They
Yeah.
transfer at that time.
Right,
Yeah.
right. So just really happy to be here. And I have worked, if some of you are from the Valley, the Banner system used to be Samaritan.
Mm-hmm.
And Samaritan Health Plan was owned by Samaritan Hospitals, half, and the other half by Tucson Medical Center. They went on to become Health Partners Health Plan, and that's where United Healthcare bought them. And that's how I ended up at United Healthcare. So United is the biggest carrier in the country, and then Cigna, Aetna, and there's been a lot of consolidation in the whole industry, and we'll talk about that later. So that's it.
We thought we'd start by talking about the market conditions, and as long as I can remember with my experience in human resources, one of the most challenging issues has been the rising cost of health care. And through that 20 years, I think it's risen 4 to 5 times inflation, and it's always a challenge to be able to offer insurance that is competitive, that is cost effective and sustainable, and that offers the options that are comprehensive for our employees. So I think that's the challenge of the day. Who would have thought that the market would get even more volatile than it's been over those 20 years? But I think that is where we're at today. And Rick will spend some time talking about how PPAC or the ACA is going to impact the city.
Yeah, I think every day there's headlines about it and news stories and radio and TV. So almost everyone's kind of an expert on healthcare reform and hearing different news stories that come out of what's happening. And it's things are in turmoil. The industry has been in turmoil. It's been broken. And healthcare reform is trying to get some of these things fixed. There's always the unintended consequences of laws and things changing. There's been a lot of added cost to employer groups, to many of the employer groups in the country, due to healthcare reform. In terms of the exchange itself costs $500 million. The employers are paying for that, basically. And so percentages are being added on to the renewals to pay for exchanges through the federal government. And then benefits are being mandated, so those are being added into the cost. So the underwriters and actuaries add these into the premium costs at renewal on top of just what's normal trend in the business, which has been running in the teens for years. It's relentless, and it is unsustainable. There's many good things about the law in terms of doing away with pre-existing condition limitations and doing all these medical questionnaires. And so many people who could not get insurance, they were just denied, especially in the individual market, where people, if they had 3 conditions or if they were on 3 medications, they were denied. If they had a major condition, they were denied. Just flat out could not get a policy. So we really feel at the Levitt Group that it's a really good thing to start changing some of these laws so that people can get access to health insurance coverage. Mike Levitt is part of the Levitt Group. He was the Secretary of Health and Human Services and has worked with a lot of the exchanges. He's working with probably 12 states now. So he kind of updates us on where things are headed on some of the exchanges. And the one in Kentucky's working pretty well because they've kind of done their own thing and had something in place. Massachusetts has been running for quite some time, 8 years. And so that's still functioning. So there's been the pricing model is the biggest change that's come out of this in terms of how the actuaries set the prices for the premiums. And the law has changed how they can do that. And it's narrowed the spread on age. It used to be 7 times a spread between the young and the older population. Now there's just 3 times the spread. They can't discriminate based on gender. They used to charge a lot more for female in certain age groups than males. They've done away with that. They can discriminate smoker versus non-smoker, and prices are set based on basically geography and then the networks that people are in. And so the rules
Joe, you have a question?
have changed.
Yeah, just a follow-up. On the Affordable Health Care Act, you had mentioned some of the cost of setting it up and the cost of these additional benefits you have. Some of them are really good. What does that translate into percentage, do you think, that's going to be part of our increase this year?
Well, they've already added to all our other renewals about 4% to the cost for the exchange and some reinsurance things that are done. So the carriers, which were down to basically 5 insurance companies, or 4 major ones, and they're referred to as BUCA. It's Blue Cross, United Healthcare, Cigna, and Aetna. Then there's the 2 H's, HealthNet and Humana, and then a few others like Starmark. But all of those companies are adding about 4% to the renewal just for the exchanges and healthcare reform law. They're also adding for the mandated benefits probably 3 or 4% for covering all well visits at no cost, not having co-pays and that kind of thing. So they've kind of actuarially priced some of the benefit changes in there. And that's being layered on top of annual trend, which is about 12%.
So we're talking about 7 plus the trend?
Yes.
About
Yes.
7 plus the trend.
Yes.
Okay.
And that's on your average group. If it's running normally,
Right.
it's going to have that kind of increase.
Okay. Now, and again, you don't have a crystal ball, but what if the makeup of these pools, so to speak, don't equal out where, say, for example, they get all those with preconditions signing up versus the healthy ones? How may that affect us?
You've been doing your research, Vice Mayor. I can see that that is the crux of the whole of the exchanges. If the exchanges don't attract 3 million young people, they kind of implode. So far, they've been attracting. It's the jury's out on it, but the early indications were it was the sicker people, older, getting people who really need insurance. I worked for the Banner system for years, and they always had people in the hospital signing people up for access and Medicaid. Now they've gone out and hired lots of what they're called navigators, and they're signing everyone up who's in the intensive care units, who has scheduled surgery over the next 6 months, to get them in the exchange and get some insurance. So those are the first people coming in. You're seeing lots of billboards. I was in California last week. Lots of billboards trying to get young people to sign up. It's always been a challenge, to get the young people to see that they're not indestructible and they can have a motorcycle accident and, have issues. And so that's the
Do they
real
have a
challenge.
percentage on those issues? I mean, do we know that for a fact? I mean, the number of people that do not have insurance that had some catastrophe happen. I've never seen a percentage of that when they've been selling this. It's just been, well, I know better. I'm mother or I'm father. I'm going to tell you what to do. And for the young people, that sometimes I feel that way. So I'm asking, is there actual factual percentage on that statement?
It's hard to come by.
Yeah,
It's more
that's-
anecdotal
That's what
that
I
I've
felt.
seen, Mayor,
Yeah,
in
okay.
terms of the
So
numbers.
it's a fairly good argument on the younger generation that are fighting this of not wanting to do it. It's nothing against
Yeah.
what you're saying today, but it's just a point that I'd like to make. Sherry?
Right.
I kind of want to
Yeah, you're here.
I kind of want to piggyback on a couple of those questions because when this originally came out in legislation, I guess the spin on it was the employers and those covered under the employers would not see any difference or increases. And now from what you're telling us, it could be a 20% increase. Is that kind of what I'm hearing, even though we're not on the exchange?
That's correct. The employers are taking the brunt of a lot of unintended consequence. The idea is to get the uninsured insured and bring young people into the insurance pool. Many of the employer groups, their young people in the private market especially, have waived coverage. So it would be good to get them into the insurance pools. The fear by the insurance companies is that these pools will become risk pools. And so in California, for example, we have about 125 offices, probably 40 of them are in California. There are 3 big carriers of the 4 are not participating. United Healthcare, Cigna, and Aetna are not participating in the California exchange, which is the largest in the country. It will be if it continues. The only plans participating are the Blue Shield and the Blue Cross plans, and then local plans like the Chinese Health Plan of Los Angeles, Marin County Health Plan, because they're waiting to see what happens. Insurance companies are very risk averse, First of all, they don't take risks. It's like they're just like the casinos. You know, they take the vig. They can predict. They have actuaries or pay a lot of money to predict outcomes and claims, and they just add on their margin and their profit. So they're fine with mandates and things being added in to coverages because they make more money that way. Getting more insured customers, it's good for them. But in healthcare, 65% of all healthcare is already paid for by the government, Medicare and Medicaid. So the private market is, you know, the rest 35%, and that's what we're talking about. And it's that individual market that's most broken, and that healthcare, a lot of what you heard Obama or the others talk about was that individual market where people are denied coverage, and that's what they're trying to fix. And fixing that, the employer market is paying for a lot of the problems of that individual market, which granted, there were a lot of problems with that individual market because they were just picking and choosing who they wanted to insure. Now they can't do that. So in doing that, there's laws about small case. If you're 50 and under, there's rules about how that's underwritten. 50 and above, they can still ask for health questionnaires if they want to. So the law gets at different elements, different size groups. It affects people very differently and different employer groups. But the bottom line to employers is it's costing them more money. Many small businesses are just saying, go to the exchange, we'll pay you more. They're finding if their employees are higher paid, they don't get any subsidy, and the rates are quite high. So we'll have to see where those rates go, especially next year when they see who they're insuring. And they will insure each of these pools of the exchange based on who comes in. And my advice to employer groups, and most of my groups over 20 are keeping their plan in place, and groups over 100, you get your claim experience. You want to wall yourself off from the chaos that's out there, that we see happening out there in the exchange and that free market. And you want to do wellness, you want to control your destiny by having wellness and taking care of your employees and not having them part of this risk pool where you will not have control over that pricing.
Joe?
As a follow-up to that, too, with, as you mentioned, the chaos or some of the things, the unknown that's going on out there right now, how does that impact an organization such as ours? If you go out to try to bid now in that fluctuation or try to modify what you currently have, would there be tremendous risk in trying to go out on the market because of what's kind of going on out there? Will that hurt you?
Well, you're getting to all our points of where our options are.
You can tell him that further on, all right.
That's
so
okay. But
we'll
you know,
hold it till- we'll
a
hold
quick
it till
answer
then.
is when you go out to bid every year, it can hurt you. It doesn't always help to bid and try and go out and see what you can get out there. And we'll get to our recommendations not to do that.
Okay.
So just to follow up on this, trend is still 12%. If you're just a normal group, it's about 1% a month. The thing that when you get a renewal, you get it 3 months ahead of time, so they're adding 3 months of trend, so you're really getting 15 months of trend. That's where you get 18, 20% renewals. You don't get a 12% because they're doing the work early, 3 months early, so you're getting that 15 months of trend, and there's complexity how they do that.
But that's 12 plus 7, though, right?
Right, of
So it's
what they're
19.
adding in, right.
So you're looking at
That's
20%.
right.
See, he's our number guy, so
No, I know.
you can
Yeah,
expect
yeah.
that through this entire process.
Mayor,
Yes,
so
Wally?
are you now saying it's ours will be 20%
No,
higher?
I'm thinking that's base.
Because you're
Just
getting me
average,
confused.
Just what we're seeing. No, we'll talk later about what we've gone to Cigna, and
But you're
we're hearing
saying
some
don't
numbers.
go out to bid.
We do. We've got towards the end of the presentation, we've got some options that we'd like to get some feedback on,
Okay.
and it'll get into those points and talk through some of the pros and cons of each of those. Which one of them might be go out to bid, and then there's some other options.
Okay, do we know how much ours, is it in the presentation, how much it's
We
going
can
to
talk through those.
increase?
Yeah, when we get to those options, we'll kind of talk about the census that we're getting from staying with Cigna or renegotiating with Cigna versus what we might experience if we went out.
Thank you.
And I was just looking for clarity because you have 12 there, but in reality it's 19.
With the add-ons, right.
And can we hold that off for them to explain that one more
Yeah.
time to
Yeah, we
make
will.
it more
And
simplified
I'll-
for
I'll-
us that are not as familiar with it? Okay, go ahead.
Sorry, Mayor. I would just hit on the market trends. The last couple is the move back towards capitation, which when I moved here 23 years ago, there were about 30 HMO plans, and they were capitated, which means that the insurance companies got paid so much ahead. That's what is happening again. It will happen over the coming couple of 2 or 3 years instead of procedure codes. And the hospitals are seeing that also. And then the inner networks, you're hearing lots about smaller networks on the exchange. You're seeing doctors in California especially, and you'll see in Arizona doctors saying they're being cut out of the networks. This is all bad. And, there will be inner networks that will drive price down and would be an option for employers to look at. And that's the other trend that's really strong out there. And just the banner network, say, which has 2,000 physicians versus 6,500. And then you'll have Scottsdale Healthcare System with another inner network type thing. So that's the trend you're seeing now over the next 3 to 5 years.
Quick refresher on where we're at today. We have the 3 plan options. We have HMO with a $750, $1,500 deductible, and we have the 2 high deductible plans with health savings accounts. On the right, you can see where our distribution is. We've got about 66% of our employees in the HMO, 28% in the 1250, 2500 deductible HSA plan, and the other 6% in the higher deductible plan. So that's our current distribution and an overview of what we currently have in place in terms of plan options.
Joe?
Back to the other slide there real quick. One question I'd like to get answered, and I know you have a survey that you're going to survey the employees, but I'm never quite sure on that HMO whether people are gravitating to that plan because they're just enamored with their Cigna doctors, or are they gravitating to that plan because it's the cheapest. For example, if you're married with kids and you got a spouse, and you have to kick in $2,500 or whatever that number happens to be before your insurance kicks in. And then they look at the other plan that has deductibles and copays. Are they going there because it's the lesser of the two? Yeah, and I'd like to know that of our employees, if that's the reason why they're going. Because I think it's important if they're going, not because they want to go there, but because they can't afford not to go there. Does that make sense?
Absolutely. Vice Mayor Pizzillo, that's one of the things that you mentioned with the survey we want to ascertain. I think, in my experience, there's a number of factors. Part of it is education around the high deductible plans and how they work. To many people, those are scary because your copay, you know what you're going to pay your doctor when you go in, versus the other plans. People are less apt to gravitate to those plans given the uncertainty of what they might spend. So part of it's education, going through, and I think we can do a better job this open enrollment. We want to try and get out ahead of this, so part of what we want to gather today is an understanding of what option we want to move forward with. But by doing that, that'll allow us to get a little further out ahead of this and be able to offer a little bit more education about the various plan options that we have. In some cases, I think the general thinking might be that the HMO might be a less expensive plan to an individual, where, depending upon how they use health care, it may not. So being able to educate and walk them through how the plans work and which one might be the best plan option for them might reshape that. We don't know. I think I would be guessing if I was to speculate why they're gravitating there, but I know that in my past experience, some people gravitate to that plan because of the known versus the unknown.
And I think it would be just helpful to know that.
Sherry?
I have Phil Donahue over here. And I think something else is important that we let the employees know. I think there was some confusion last year that the HMO, you could keep your own doctor if they weren't an HMO doctor. I think we need to be really clear that if you have a doctor you like, especially with everything that's going on right now, if people want to keep their doctors, I think we need to be very clear what plans, if you have a doctor that's not an HMO, that you need to select from and let them know. Because I think last time when I asked this question, it seemed a little fuzzy, and I think there was some confusion that if you pick the HMO, you could still go to your doctor. And I just, with everything going on, if someone really likes their doctor, and we need to be clear with the employees on that, because I don't want anyone to feel misled or anything.
Councilmember Loretano, I absolutely agree. We've spent a lot of time working with Cigna over the last 6 months to iron out some of those misunderstandings, and we're committed to do a better job of explaining that this go around. We know that the communication that went out talked specifically about wasn't primary care, it was actually pediatricians and OBGYNs you could keep. And there was some additional follow-up. So what Cigna designed for us was a plan that had a lot of things that they had to do behind the scenes to make it work. We want to stay away from those kinds of things so the plans operate a little bit more seamlessly. And we've been meeting with Cigna regularly. Rick has jumped in as well to spend some time talking about how we want the plans to work going forward. So we're committed to do that.
Thank you.
Next, just a quick overview of our loss run. There's some good news, bad news here. The chart on the left is a 12-month running graph of where we're at. You can see those red spikes, and if you look, let me find the cursor here, you can see some spikes here in the months of January through April, where we had large spikes there. Unfortunately, that's been a trend that we've seen over the last couple of years. Whereas if you look at our current plan year from July through now, we're actually running at a 77.7% loss run right now for this plan year. However, the trend reflects these spikes that we've seen. We're hoping that we can change that trend. At present, and Rick can talk to this a little bit more in detail, the insurance companies are going to look at that loss run as they develop our rates. And that running total of 91.8% is the 12-month that they'll look at. They'll actually go back and look at a 24-month run. And, it's a good news, bad news situation in that we're hoping that some of the things that we're doing are having some impact, but that's yet to be determined as we go through these next few months where we've seen spikes in the past.
The good news is you're not over 100%, where they're losing money on every premium dollar. But they like you to be at 80-85% loss ratio. That leaves money for reserves and for their profit and their expenses. So that's the desired. That's where the government is saying if they make more than that, they have to return monies. So that's the target. So you're over that. The winter months are usually higher for every group, the flu season and people going to the doctor and getting things done. But you had some history of some large claims in there. And we'll talk a little bit about the clinic, because to us, wellness and trying to get a handle on the claims and the kind of issues that are happening within the group is key. And by letting Cigna or whoever the carriers know that we're concerned about it and working with it, will help in negotiating with them, that we're partnering to really get the population healthy. And there will always be claims that you can't do anything about, issues, but on ones that you can identify early and not have them become high-cost claims, because it's still the 80-20 rule that 20% of the people drive 80% of those claims. It's just how it is. And so it's targeting those pre-diabetics and the people before they become diabetic is the key to a group controlling their destiny on costs.
Here.
Yes, sorry, Wally, go ahead.
Do we have a cap on the catastrophic claims that we can have as a city, or is it unlimited, or how does that exactly work? Because if one big claim could put us up to 120%.
Sure. The large claims tend to drive these spikes, and there isn't a cap.
Okay.
There isn't a cap on those claims.
So those are your
Cap is your premium,
cancer
you know.
treatments,
Yeah.
cancer
Yeah.
patients,
Yeah,
and
they can be
and
million-dollar
at that
claims.
level.
Yeah, easy.
Right.
Yes.
So the 91.8%, how many total claims is that? Do we know?
I don't have the information right here. I can get that information. And,
I'd be curious. I mean, we only have 511 employees plus all their families, and I don't know if all 511 are on our plans. I don't believe they are. I know
No.
I'm not. So
no, we have
here's one.
roughly 433
433?
employees. Yeah, on
Yeah,
our
I'd
plan
like to know
currently.
how many, in comparison to last year, if you can get that for us, Lyman, I think that would be interesting to know. Then we need a way to judge if the wellness clinic really is working, or if they're putting in for the same amount of claims, but maybe different illnesses. We need to be able to measure something.
And council member Campbell, you bring up a great point with regard to the need for data.
Right.
And one of the things that we're doing, we're working closer with Cigna now to be able to provide that data, which we have. So we'll be able to
Good.
provide you with
Okay.
the total claims. But we're digging deeper into the claims, the kinds of claims. And I've got the next slide here is a slide on our clinic utilization to see how our clinic's being utilized. We're looking at all of these components to understand better how our employees are using the insurance and the healthcare system, and how we can minimize the cost drivers within the system. So that's work that we've begun to do already, and Cigna is providing us much richer data than we've had in the past.
Okay, can I ask one more question, then I'll let you
Sure.
do. Okay, so with taking a good look at our clinic and taking a look at all of our claims so far, or in comparison to last year, how many were in, or what they were for, would we need council action to implement something else at this clinic to maybe cover something we haven't been treating for, or do you, I mean, maybe I'm off base here, but I'm thinking, now that our clinic is is a referral clinic for us. Is there something, are we going to be able to figure out that there might be something else that it's cost saving to our city to have at this clinic? Or do we not do
Great
that sort
point.
of thing?
Great point, Councilmember Campbell. One of the things that we're looking at is how we can best utilize the clinic, and I think that is part of it. The services that we offer. One of the next steps that we'll show at the end, we are due to do another RFP for the clinic to look at providers. In that process, we've learned a lot. We have many other entities that are interested in our clinic model. But we've learned a lot about our offerings. In fact, we made an enhancement this last year to turn that into a primary care provider, and a number of employees use it as a primary care. Are there other things that we can do? I think those are things that we're going to explore. Those were some of the things that we wanted to pull in with a new broker consultant, his expertise in that area. So we're going to be looking at our clinic, looking at our offerings, looking where we can better control cost and offer richer services, if you will, to employees, so that will hopefully be a first option as opposed to maybe a secondary option for their medical needs.
Because we really want to provide them with the best possible care and coverage that we can reasonably. But I don't want them, I would feel bad if I heard them say we have the worst health care coverage. I would not like that. If there's some way we can make sure that we're doing, and I know we are, otherwise you wouldn't have brought on a broker to help us.
Absolutely. I think that challenge of providing comprehensive care at an affordable
reasonable cost to the
absolutely
employee.
sustainable cost is
In the city, please.
That's that balance that we're working
Yeah.
towards.
Bill?
Lyman, while we're talking about surveying the employees, I'm hopeful that we're going to be looking at asking the employees why they either choose or choose not to go to the clinic. I think there's a great value in it, but we may be missing an entire segment because we don't know exactly how the employee feels about it. The other thing that I think might be interesting is, I know personal experience having been to the clinic, and it's a very delicate balance between trying to find that, as you pointed out, the pre-diabetes patient versus, but if every single time you go in there for, hey, I've got this splinter under my thumbnail, well, let me run some blood tests too while we're there, that always increases the price of healthcare. So there's got to be a balance, and I don't know if you're hearing that. So when we look at the clinic, I'm getting the sense now, before I formulated my question now to this point, that you're really going to be digging deeper rather than just hey, we've got this great asset, that we really want to maximize it. So I'm seeing the nodding head, so I feel good about that.
Yeah, absolutely, Councilmember Stepp. We are, and that's a great question. I think that's one of the questions that we want to understand is why people use the clinic or not use the clinic. Ideally for us, the more we can drive to the clinic, the better off we are, and the more costs we contain. And if we can provide a level of service that people are comfortable with, I think we've got a win-win all the way around. One of our challenges, and kind of talking through clinic utilization, these charts depict our current utilization. And we are, we're getting close to capacity there. But even with getting close to capacity as depicted here, there's things that we can do to continue to drive more people there. And how we use that clinic, as you indicate, is very important in terms of trying to address some of the wellness issues, some of those cost drivers. Is very important. So I think that survey will give us a lot of that data that we need to make an informed decision on how we model that clinic. I think it's both a wellness element, but there's also a cost containment effort there, and there is an opportunity to drive and do more with our providers, working directly with our providers. So we're looking at all aspects of what we can do to make that a better model for delivering healthcare services.
Joe, did you have another question?
Got a couple, just to follow up what Wally had mentioned on the premiums. Do we have a catastrophic policy on top of our premiums that covers, say, claims that exceed a certain dollar threshold?
We don't currently have a stop loss, any kind of stop loss coverage.
Anything like that?
No.
I just wonder, and just a question for the broker, does that help us anything if you have something separate for those that maybe go over a 200,000, 250 threshold in a separate category versus all into the premiums? Just a thought. On the other one, dealing with the clinic, it's my understanding too, every time there's a visit, there's a dollar savings versus what you pay the doctor if we go to a doctor visit versus the clinic. I don't know if you know off the top of your head what that number is, but that would...
Vice Mayor Pizzillo, the number that we work with, and this we kind of look at our break-even point for the clinic. It's $118 for a primary care visit. That's what would normally hit the plan for a primary care visit. So based on that, we hit a break-even point at about 1,694 visits to the clinic. These charts here depict the first 2 quarters of the calendar year last year, and we had 1,920. So we hit our break-even point and went beyond. So the clinic is clearly a cost containment vehicle for us if we could drive people there and if they feel comfortable with the care that they're getting there. And that's just for the primary care. They do some level of specialist care from time to time, but very limited. So I think back to those questions that we asked, I think those are critical in terms of the kinds of services that we offer and how and if we grow the clinic in some capacity, what are the added services that we would want to offer in the clinic and what's cost effective? What can we do in a cost effective way that addresses these issues?
As far as the risk is concerned, I imagine well, I'll just ask the question. The individuals running the clinic have the proper medical insurance, et cetera.
Absolutely. They bear the liability. They have the proper licensing. And I think when we go through this next RFP, we'll explore some other things that we have learned just in terms of service, hours of service, all kinds of things. As we look at workers' comp and as we look at some of the other services that we contract out for, so for our law enforcement, AZ post certification, physicals, that's something that we contract out now. Those are services that we could bring in-house and save the city money. So there's a lot of opportunity there that we're looking at. We want to explore in this next round of RFP.
Vice Mayor Pizzillo, I would just
ahead.
touch on your
Yeah.
question about the stop-loss insurance on large claims. Because you're fully insured, you don't need that insurance because you're paying your premium. No matter what happens, you'll be covered catastrophically. It gets at the question of self-funding and partial self-funding, in which case you would have to get that reinsurance and have all sorts of specific stop-loss for the individual and then aggregate stop-loss on the group. If claims went over 25% of expected, it gets into large claim activity. But you're covered because you're fully insured.
Okay. No, the only reason I was getting to it is if you get to 100 or 105 or 110% because you have one $500,000 claim, that would impact your whole premium for the following year. The only question I was getting to is there value in doing that? And I'm hearing probably not. Okay.
Go ahead.
Okay. Very quickly, just want to give you a quick update on some of the wellness things that we have going on. And I think there's been a couple of questions with regard to health risk assessments, at least using the clinic to do these things. We do run a health risk assessment, and the first one we ran this year, we had 267 participants. So that's about 61% of our employee population. Pretty high number. Our total covered members, it's about 20.5. We've got another one coming up in January. Those are areas where we need to connect the dots and bringing in that data, which this is the first year that we've actually taken that to the clinic so that the clinic can begin to address some of the things that are coming out of the health risk assessments. And we want to further take that data to understand where we need to direct our wellness program so that we can address the cost drivers within the system. On-site mom and pop van, we have that coming again this year. Flu shots. Some of the other things we're doing, and if you look at our health risk assessment, one of the key factors that focused on preventable catastrophic events was just getting out and exercising. So we know that that's a factor. We're trying to do things that address that, plus lifestyle changes. So you'll see some of those things. The kickoff lifestyle challenge is going to be coming up. That's going to have a weight loss challenge. So again, we're driving it to address issues that are coming out of the health risk assessment. And hopefully that will curtail costs. We're also, one of the things going back to the selection of the Levitt Group, they have some robust metrics as well as they've got some in-house expertise in the area of wellness. So that was another part of our selection in choosing them.
So I'll touch on cost containment strategies, and we've talked a fair amount about the clinic, but you really are cutting edge by having this clinic. I mean, you're way ahead of many, many other cities, towns, employers, and I've been in business my whole life, being genetically engineered for it, and the pendulum has swung where it used to be clinics. There used to be a lot more in when I first got out here. I used to work with Lockheed Martin and Honeywell. They had clinics in the buildings, and they're coming back to this now, to the point now Scottsdale at the end of the month is having a big conference on clinics with many companies. Goodyear Tire and Rubber is one that has a clinic talking about it. So, it's really a very few number of companies and towns and cities, municipalities that have this. And it's coming back to realizing the value of that. I view it as kind of the control room of the Starship Enterprise. If you control that clinic, you will have the data, all the information will be coming into you on your group, and it will just fly much better by having that clinic and having it do things like maybe naturopathic medicine. We're seeing a lot more of that in our groups. Different procedures, things that are offered to people that are willing to do that, and done more cheaply than procedures. And physical therapists. So there could be lots of other things done in these clinics that we'll be looking at that are really cost effective. The plan design is underwriting. It's like looking, driving people into right plans. That's why we are talking to Cigna about the other plan, the plan that used to be here, Open Access PPO, and looking at the cost differential. It's about 8% higher cost if you just have that in, but we can negotiate down. Because they've been with you, and we're going to look at that hard negotiation with them and offering some different plans, possibly. The survey is important of the people, as you mentioned, on the plan and off the plan. The people, you want to capture all the employees and why they're signing up or not. The biometric screenings, in addition to health risk assessments, many of our groups are mandating people get the blood work done and view it, get the report. Then the group gets the overall report and sees kind of the diagnosis of the group. We have our own wellness physician that works for us. We actually have two now. One's they're both in Phoenix, and they do the different offices for us. But they will come in and help diagnose the account and get some plans in place to say, okay, we've got a lot of pre-diabetics. Let's do these kind of things. Or we've got smokers. How are we going to deal with the smokers who are now chewing tobacco and get them off chewing tobacco and that kind of thing. So it's a continuous process. It's behavior. And it's not a one-time kind of thing. It's a lot of communicating, and that's the way we work with it. And we partner with our groups to do it ongoing. It's monthly, quarterly, ongoing for years, because it takes years to get the payback on it. And hopefully your employees are with you that long. That's why we like working with municipalities where there's not huge turnover. It doesn't work if you have 50% turnover. So linking contribution strategies to the wellness activities is important, and having the metrics and the reports tied in to the underwriting part of this. And that's what we do. We have underwriters dealing with the physicians on it. So it's a lot of strategies, it's a lot of work, but it has a big payoff.
Okay.
So, well, the options, stay with Cigna as is an option. That's always, the do-nothing approach, and, is everybody happy? Some groups it is. The other is to look at Cigna, negotiate, look at some different plan designs, at some options, early on negotiating with them. The third option is to go out to bid to the carriers, and again, there's the 4 major carriers, see what they come back with, as we do when we bid out, our accounts, and try and negotiate something with somebody else. And I would say that you've done some bidding in the past. I've kind of tested the waters. It's a small world. It used to be much bigger with these carriers. And you got to be careful when you're bidding constantly, because you can get a little mark next to you. And, underwriting is not a science. It's an art. And you want to be attractive to the carriers. And it's kind of like Match.com. You want to look good to them. We use old pictures, but you want the underwriters to want you and come out with very attractive pricing and benefits for you. And that's how you're presented. If you stay with one question they ask, how long have they been with their carrier? It's a question. How many carriers have they had in the last 5 years? You get points against you big time if the answers are had a lot of carriers. We were out to bid often, and you can get no quote. We've got many groups who are out to bid to the 4 carriers. They're getting no quoted by everybody. The incumbent knows this. It's a small world. They know that they've been no quoted everywhere. All of a sudden, the rates are jacked up sky high, and they have nowhere to go. Everybody has these horror stories, and you got to be very careful about that, about the bidding process. So in talking to the carriers and Cigna, Lyman, our recommendation is to negotiate hard with Cigna. We get a lot of points for not going through the bidding process. They don't want to go through it. It's a lot of work for them. The carriers lose money by bidding and having all that happen. And so negotiating early and locking in some different options gives all of us time to deal with it and deal with the the contribution strategy for the employees, doing the surveys, doing the communications about the plans, and really working with the employees so everybody understands that there's options and there's a price for every option. And we feel that communication is the key, multiple layers and levels and ways of communicating, because any one way is not enough. It's got to be multiple ways. And so that's the option that we, at this point, would recommend.
Comments? Bill?
Yeah, I know sometimes we're hard to tell.
I know.
I know we're not going to take a vote or anything like that, but I certainly would be in favor of us remaining with Cigna and doing as you suggest, not going out to bid and negotiating direct with them. I know that you talk to employees and, every year it's, well, who are we going to have next year? What's going to happen? So I think bringing some stability to that, there's a lot of value in it in addition to everything else that, from a practical standpoint, that you mentioned as well.
Jerry?
Yeah, I agree. I guess the gray option is the one I guess you guys are recommending. It kind of goes against what you think you should do. You should always go out and bid, try to get
Because
lower
there's always
bid.
something out there.
Yeah,
that's
you
something more
RFPs,
rosy.
everything else, we go out and we bid. But I understand what you're saying. It makes a lot of sense, especially now. When we go out and bid, does it have to be for a year term? Or since we have all this chaos around us, can you do it for more than a year? Can you not? Can you? I don't know how that works. But I'd like to see you try to tweak the good things and try to improve the other things on what we have.
Joe?
Could you go back quick to that slide of what we currently have? Oops, go one more. From my I tend to agree with them. I'd like to see if you could tweak the bid with Cigna. What from my perspective, and it depends on, again, I'll hold it to what the survey is, but I like what you have there for 1, 2, and a third combination instead of the two HSAs. The third combination somewhere where they can pick their, they can pick their own primary that you were talking about with a PPO, as opposed to that third HSA. That's kind of where I'm kind of coming from. I don't know if that's what you're going to get when you come back from your survey, and if it's different, I'm amenable to that. But to me, it doesn't make any sense to have two SHAs that close together like that. A third one that gives them another option.
Wally?
Well, when are you going to do this survey? Because I want to hear from the employees before I make up my mind. If they're not happy with this, I would not necessarily know. So when's the survey going out, and when are we going to hear the results of that?
We'll just going to cut through the slides here, and we'll just jump right to next steps here. I'm not sure that I have the survey on here, but the element that precedes that is our new insurance committee, which will be in place here shortly, and thereafter we will do the survey during the month of January. So we'll get that information back.
Before we start our negotiations on the
Absolutely,
budget?
absolutely. We would have that back before
Okay.
we would start negotiating.
And are you going to pick the questions? Y'all are,
Yeah,
as far as-
we'll work through the questions. There's
make
a
it
number
real
of
personal to our city, to our employees. Please don't make it so general that it could go to New York for,
Councilmember Campbell. This will absolutely be a survey that's specific to the city of
Okay.
Goodyear
Okay.
and our
thanks.
plans. And some of the questions that have been asked are excellent questions that we'll include in that survey.
I also agree about the doctor. I'm not on the city plan, but that's my concern for my future, that I need specialists, and I hate to have to hunt around. And since the big changes, some of the specialists are not going to, they're going to abstain from this
Yeah.
and go into different avenues. So I think that's extremely important for those individuals that have really unusual circumstances medically
Yeah.
and for their children.
Could I ask one more quick question?
But of
I'm
course you
sorry,
can,
I have another
Molly.
question for you. Is this Obamacare mess going to impact what we can offer? I mean, nobody knows anything. I mean, it's a mess. But because of what all they're offering to everyone to go get insurance, a carrier's not going to come back and say, okay, we can't do this sort of thing because we're having to open it up to everybody. Are we going to be treated as our own entity with our own requests?
Yes,
Okay.
we are going to request plan design. Because
Specifically
you're a large
for
group,
us.
it can be more designed towards you, yes.
Okay.
Now, we'll have, if there are federal laws that say they have to offer certain benefits, then they'll have to include some of those. They would be maybe extra beyond what you
See,
have.
I think it was you,
Yeah,
the way you
I'm there.
the way you approached it was probably a little rough on it, but that is a problem. People don't know, and all we have right now is basically the newspaper and the TV media, and it's extremely alarming to everybody. And and then you've got your congressional people talking, and there's no one message there except one: get rid of it. So that's not going to happen. So, I mean, I guess that's where it's in the communication end of it. And you get just one or two employees that don't understand something that start the message going around. Then Joe goes and visits them one day and says, how are you doing? And it comes back. And those are the things that really concern me. So I think being able to really, sometimes you have to go out of the line to explain what certain things mean, because all of this is quite new to the public, because we're very used to in the United States of getting what we want. And having lived in Europe and knowing the system, you don't get what you want. And it's not on your time schedule. So that's the other thing that I would like to make sure that the employees know, is time schedules on events that happen medically. And how quickly they can go to see a doctor, because I can't imagine that's not going to affect that, is timing.
Yeah, that's
Because
what I'm worried about.
we're going to have less doctors now,
Yeah,
more
that's what I'm worried
nurses.
about.
Thank heavens the nightingales are coming out now. We're going to have more nurses. So those are the things that concern me. So any information that you can give us in that direction, and I know it's not clear at this point, but it will, I understand, come out very soon. So.
Absolutely, Mayor Lord. We'll plan on making sure that our open enrollment presentations include that. And I think you bring up a good point about plan design changes, and sometimes it's a detail, and sometimes it's hard to catch all of those details in terms of
And
those
they're
plan
ever-changing,
changes.
And
But-
they're ever changing in this atmosphere.
Absolutely. So we'll be committed to make sure that we're communicating those effectively. And I think you bring up a good point about access, and that makes the clinic all the more important. We have a number of employees that I've talked to that they love the clinic because they can get in.
Now,
Where
when
they
you
can't
say-
get in
Yeah,
to their
when-
primary care for days or weeks, the clinic is usually accessible within a day or two.
So are we actually going to have to enlarge the structure or move them into a
I
better
think those
facility,
are-
or are
I
we
think-
talking just about individual employees coming into it working?
And I think we need to plan long-term, and I think that's something that over time, we will have recommendations coming out of our insurance committee to talk about where we want to go with the health clinic, but we would certainly be bringing those things back. The clinic can be a Taj Mahal, or it can be offer the basic services that we're offering today that are meeting our needs. Over time, how we want to position that clinic, I think, is important in how we want it to impact our overall cost and, as Rick mentioned, control our own destiny.
And to be sustainable, so.
And be, absolutely,
Okay,
most
yeah.
importantly, be
All right.
sustainable.
Sherry?
And I have to wait. Always have to wait. And speaking of the clinic, I wondered when we get the statistics and the information, how many times have somebody gone there and, because I know this happened to us, and we've been referred, we can't handle this, and one time we were referred to Phoenix Children. I know that cost a lot of money, but that's where they sent us. So I'd like to know how many times, and I don't know what kind of data you can get for what type of illnesses they can't handle, so we know if that's a gap that needs filled, and we can save money that way. Because I've been very happy with them. I think they're great, and I hope they could handle more. But I'd like to know if it's being referred out, then are we paying like kind of twice for that visit?
Well, that's probably information that will be easily given if you make the criteria, and that'll be part of the criteria. They'll know. There'll be a list, I'm assuming.
Sure. Councilmember Loretano, we are working with the clinic, and we're getting data from the clinic as well. So we're getting all this data, and we're merging it together so that we understand, again, how our employees are utilizing the systems and the benefits that we have. But that's a great one because they do capture that data on when they have to refer someone someplace else. All of their referrals are captured. And as we look at either going out for an RFP, I think that's an area that we even need more robust data, is how the clinic is being utilized. So they can offer some pretty robust data today. We just need to get that and use it in a way that answers those kinds of questions, and that's what we're working on right now.
And then my final question is, as we get this data, as we're forming the new or adding on to the clinic, I would like a regular, and I think not me alone, I think the rest of them would like regular reporting on it, and I would like to see it publicized. I'd like the citizens, I'd like a continuous story told to the citizens, the money and time is involved, and the money we're saving for the citizens, and the kind of care we're giving the employees. So I think it's really important to put that in your plan along with everything else. Okay, thank you. Is that it? Any other questions? Well, thank you. Thank you very much for being here today. I hope your questions were helpful to you. It kind of gives you an idea of where the council is on this. And the nice thing you've heard is that whether I don't have a health plan here, and there's a Bali, but that we care about it. And remember, we're from different avenues of health care, and a lot of times Wally and I have a very difficult time coming from TRICARE and Medicare. We don't really have a big scope of understanding, so simple language and explanation helps, and tonight was very good, and I thank you very much for it.
Thank you.
Thank you. Really enjoyed being here with you.
All right, what we're going to do you mind, we're going to take a 10-minute break here, and then we'll come back for the second item.
Thank you.
See, I actually saw that clip because that was one of the clips that was playing.
All right, we're going to reconvene. The next item is a briefing on the transit services provided in Goodyear and in the West Valley. Bob Beckley, Deputy City Manager, to present. Bob?
Good evening, Mayor and Council. We have guests tonight, but what we're here to do tonight is really to set up a discussion for Council. We have brought information from some of the requested information from Council previously about the costs and what existing routes that we have within the city currently. And then we're going to kind of sandwich the presentation. I'll do the quick intro, and then the representatives from Valley Metro will then do the kind of regional perspectives, talk about the costs, talk about some of the routes information. And then I'll come back at the end to talk about the marquee revenues and go into that in some detail and talk about the potential circulator route, what some of the costs were from the Southwest Regional Local Transit Study, and then come up with a couple questions that we have for Council that may spur directions. We have some suggested actions that could be considered by Council, and we'd like to get your feedback from that. So with that, I will begin by first introducing the gentleman here before us. We have Bob Antila, which is right there, Paul Hutchins, Darren Lozano and Jorge Luna, who you've seen before. The first part of the presentation by Valley Metro will be to talk about the current programs, as I mentioned, in the city, to talk about as well as potential service expansions. We have, following the update, we'll go in a little more depth in terms of transit revenue and cost for a circulator route also. With that, I will turn it over to Valley Metro, and I'll open it up for, get this escape. Good.
All right, perfect. Good evening, Mayor, members of council. Thank you for allowing us to be here tonight. So I'm going to talk a little bit about the transit services and some outcomes of the Southwest Valley Transit Study, and then Paul's going to talk about the financial aspects of transit. So to begin, this slide here shows basically all of the transit services that are provided to Goodyear today. And actually, these are as of January 27th, because in about 2 to 3 weeks, in 3 weeks' time, we're going to actually have expanded services, I'm proud to say, in the Goodyear area. First off, let's start off on the local routes. There are currently 2 local bus routes that serve Van Buren and McDowell. The green line actually represents where the McDowell route currently ends at Litchfield Road today, and come again January 27th, it's going to actually be extended to Pebble Creek Parkway. That's an additional 2 miles within Goodyear. In addition, currently this service is operated at 60-minute service, and in a few weeks' time, it's going to actually be operated at 30-minute service. So it's improved service. Again,
Do you
it's
mind
something.
going over that one more time, just slowing
sure.
it down just a little bit?
No problem at
and
all.
Tell us those lines one more time.
So the green line you see here is the route that extends along McDowell.
Okay.
Currently, it ends right here at Litchfield Park. It turns around just around where the target is in that location. And come January 27th, it's going to extend 2 miles out to Pebble Creek Parkway. Right now, Public Works is working with the City of Phoenix in terms of determining stop locations, and they're tentatively located, one on the west side of the intersection going westbound near the CVS Walgreens right there,
Okay.
and then going eastbound right in front of the Paradise Bakery area. There more than likely will be some stops in between, being that's a 2 mile stretch, but those again are still yet to be determined. And this is beneficial knowing that the Estrella Falls Mall, of course, is coming online here in a matter of years, and that'll help build the ridership at least in that corridor. The second of the 2 local bus routes is actually along Van Buren. Now, the Van Buren route today turns around right around the Goodyear-Avondale border, and that'll continue to do that. But again, that's going to be a service improvement. Today it's operating at 60 minutes intervals, and in January 27th it's going to operate at 30-minute intervals. So again, this improved frequency will hopefully build ridership. Again, this route isn't exactly in Goodyear, but it's getting closer and moving in that direction.
We can see it. We can see Goodyear from there. Hey, what more can anybody ask for, right?
You can see the bus. That's correct, Mayor.
You could be vice president.
Let's see. Another route that I'll touch on is the Avondale Zoom. The Avondale Zoom is, of course, the circulator route that serves Avondale, a lot of the locations within the city. But it also extends along Thomas Road, or along the northern portion of the Goodyear boundary, and it terminates at the Goodyear Park. So again, another route that just barely touches Goodyear, but again, notably there is transit there. And finally, there's the Route 685 service. This is our rural route that serves a lot of the southwest, the Maricopa County area. This actually travels from Ajo, Gila Bend. It goes through Buckeye, extends through Goodyear, Avondale, and eventually ends at Desert Sky Mall. This schedule right here shows you the frequency of the route, and essentially there are 5 trips each way. Not a lot of trips. It's a very long route. And these stops right here are actually the stops that are outside of Goodyear City Hall. These are the designated times. So as you can imagine, being that one is at 4:20 a.m., it starts its route around the 2 o'clock hour in the morning. But I will say one thing about this route. It's a very successful route in terms of rural routes. We looked at the ridership over the last 6 months, and we saw that approximately 280 people were boarding from Goodyear. So about 200 people are using this service over the last 6 months, which represents almost 20% of the entire ridership. So these are pretty sleek-looking buses that you'll see in the northern portion of the Goodyear area, and it's a very, being that it's a long route, the community is very involved in it. They know the driver by name. Some people jump on the bus, just take the bus.
Are they
So
selling
it's a
coffee on the bus yet or not?
Not yet.
Okay.
We have water bottles actually
Yeah,
now,
okay.
so we're proud of that.
So, may I?
Yes,
You're
go ahead,
telling me
Wally.
280 Goodyear residents are riding this bus now. Where in the world are they going? They're not going to Ajo.
Councilmember Campbell, actually, it's 280 trips, so we don't know exactly how many riders, but they could be going to Ajo, they could be going to Phoenix Desert Sky Mall, because you really get to tie into the regional services there. We know one instance of someone that originated in the Buckeye area and actually went out to Tempe to go to ASU to school. So these trips really vary in terms of where people are going. And one other thing I want to mention about the 685, this operates as a deviated fixed route. So what it means is, even though you see the line here, and this is just a small portion, this blue line of where the route travels, because by ADA or American with Disabilities Act's guidelines and policy, you must serve within 3/4 of a mile of this line. So really, it'll go off the alignment, and it could pick someone up inside this area and then jump back on.
Inside what area? I'm sorry. I'm trying to look at the map and trying to.
No, that's okay. Again, this represents a small portion of it, but for example, if let's say there's a resident that lives here and cannot access the vehicle, they could call in and request that the vehicle actually deviate off its line, pick them up, and then it goes back on its current alignment. And it operates that way the entire length of from Ajo all the way to, well, actually just about Goodyear, right?
That's not the dial ride.
Go ahead, Sherilyn.
Is that the what? Okay, I probably haven't turned it on.
You need some assistance.
Here's me. Tracy.
Just call me Sherry. Is that the 3/4 of a mile that they can deviate in either from this fixed route?
That is correct. Yes,
Okay.
Yes. Yes.
That's the law.
It is. Yes. That is correct.
You know that one, don't you? My golly.
And
Is that
then one
working?
last route I'll talk about. Oh, sorry, Jorge, did you want to speak? Yep. One last route that I'll talk about before I move on is this purple line here, which represents the proposed circulator pilot route within the city of Goodyear. And again, I'll talk about that in the next slide. Are there any questions at all on the current transit services?
Bill?
Yeah, I'm sorry, I do. The one of the things that I noticed through all of the information, both in what the city staff put together and this presentation, we don't talk at all about ridership, and trips isn't really a good indicator, at least for me, because as you said, we don't really know what that means. We don't know where that goes. Do you have data about ridership from the city of Goodyear? Do we have that information, or do we not have it yet?
So, i.e., number of people getting on the, yes.
For Route 685 specifically?
No,
or
for all of them actually, because as we progress throughout the rest of the evening here, we're going to be looking at financial decisions, et cetera, and it's merely interesting if no one's riding it.
Council membership, that's a really good question. For the 685, we certainly can get the number of riders for that route. There are other, of course, the express routes that originate from the Goodyear Park and Ride. We know that those are very successful routes, and that's ridership that we can certainly get as well. And then, of course, with the extension of the 17 to McDowell, that's something we're going to be tracking once it starts here in the end of January, so we want to see how that builds. So we certainly can get Goodyear staff the ridership numbers that originate out of Goodyear.
Yeah, that would be helpful. Thanks.
Sherilyn?
Well, I just wanted to say, is it working?
Yeah, it's working.
It's working.
Okay,
get
I
closer.
just wanted to say that we really won't get a good feel for it because it's been a 60-minute route, and the 30-minute route is much more successful, because it's really a hardship to miss the bus by 2 minutes and then you have to wait an hour. Half hour isn't so bad. So I think that getting them after they've had some experience with the 30-minute routes will be much more informative.
And I see people here shaking their head, yes, that's the way to go.
Well, can I ask?
Yes, Wally?
Why do we not keep track of it in the first place? We've been working with y'all for several years on this. So why do we not have some figures here? This isn't a new question. We've asked this before, I know. I know I've asked it. So who wants to answer? Guys, sorry. Hate to put you on the spot, but don't y'all keep track of that?
Yes, we do. We have a monthly ridership report that reports boardings by route, by jurisdiction. But the one caveat I'll throw out is that we track where people get on, so we'll have.
So we don't know
boardings
where
and
they came from.
We don't know where they came from.
Because
So-
they could drive a
so
car
for-
and park it somewhere and
That's
get on.
true.
And I think
For
that's,
instance, there could be
yeah.
Goodyear residents that get on the Route 3 in Avondale. That would show in the ridership report as Avondale boardings.
Yeah.
It's tough for us to go back and say where Goodyear residents are getting on. I mean, there could be Buckeye residents getting on in Goodyear at the Park and Ride for an express. But we can certainly tell you how many people get on in Goodyear on those routes. We just can't tell you where they're coming from.
I know, I've been out there checking them, and
I bet you have.
I have, and they're not from Goodyear that are boarding that bus at the Park and Ride. They're coming in from everywhere else. But the bus is full by the time they get to us anyway.
Well, we
from
have to
Buckeye,
look at
so.
this. So how many people do we have, going into Phoenix to work? And majority of them are probably in carpools or driving cars. And so there's not going to be a huge, but as it becomes more convenient, it's going to draw those people. I mean, convenience and timing. Yes, Sherry.
And I'm turning it on and waiting. Yes, I was wondering, with the advent of the 303, I know that's supposed to be, they're really coming along with that. Is there a park and ride in that area planned in the future to get the people coming? I think Wally just said the buses start to get full by the time you get them to Avondale, that park and ride. Is there one planned for I see no.
Nothing.
There is not a park and ride that's currently funded through Prop 400. I mean, there may be one that could be funded by one of the cities, but right now there isn't one that I know of that would be funded in the next, say, 10 years.
Joe?
It's probably more for staff, but it's my understanding the city's been working, I don't know if it's been with Phoenix or who, to try to get a larger bus on that park and ride. Is that probably looking at, well, any one of the staff? It's my understanding we were looking at a larger bus to alleviate some of the overcrowding on that, because it is
Excuse me,
such
I'm
a.
going to interrupt here. If you have this on later on your presentation, just let us know, and we'll be patient and wait on some of these. We may still ask the question, but we'll wait for your answer if we know it's going to be in the presentation.
Okay. Yeah, Vice Mayor, that is something that we've looked at. That the constraint we have right now is that the operator providing the service cannot maintain a larger bus in their facility. So, whoops, I just moved ahead. Sorry. Go back. So we are going to be talking to Phoenix about different ways or different providers providing some of those express services and try to get the larger buses. But as of right now, the provider just cannot maintain it, and so they can't operate it.
So they don't have a bus
That
okay.
their facility just can't.
Okay.
If they can't maintain a bus properly, we're not going to
Right.
we're not going
No,
to
I
give it to them and let them operate it.
But of all the issues I've heard, everybody loves that route.
Yes. Yeah.
The biggest concern is just the crowding and hopefully a
Getting on a
larger
bus.
bus. From my perspective, and hopefully we haven't had that happen, but my biggest concern has always been, and I know it's norm for people to be standing up on bus, but it goes on the highway, and all it takes is one accident, and now you have missiles. That really worries me. That's why I'm more concerned with trying to get people in the seats than standing up, especially when you're on highway, as opposed to driving on local routes is one thing, but it gets a little crazy out there on I-10, so that kind of worries me a little bit.
Thank you for the comments. Vice Mayor, one thing I'll address about the Route 562. One other change we're going to make here on January 27th is we've actually adjusted the 562 and the 563, which also serves the Goodyear Park and Ride. we adjusted the schedule a little bit. Now, we're not saying that's going to answer everything in terms of the overcrowding, but we're hoping, we looked at ridership, we looked at trips that were overcrowded and those that had less riders. We're hoping the way we tweak the schedule, we're going to help alleviate some of the overcrowding. So again, that's one of those things that we'll be tracking as it's implemented. Moving on, I'd like to talk about the Southwest Valley Local Transit Study that was recently completed. My colleague here, Jorge Luna, came and presented that a few months ago, all the recommendations. And really what I'd like to talk about is the central area here. But to start and to give a little bit of context, I know everybody's eyes are kind of drawn to this orange boundary here. And what this really represents is the optimal transit service area that was focused on for this study. So if we're looking at transit investments in the Southwest Valley, this was determined based on future population, employment, where people are going. This was kind of the area that was looked at. You see here these sub-area 1, sub-area 2, sub-area 3. These are relevant because sub-area 1 is really where the near-term recommendations were focused. In fact, the extension of the Route 3 or the Route 17 and the improvements for Route 3 came out of the study and we're in fact implementing them in a few weeks. The Goodyear Circulator, of course, was an outcome of that effort as well. As you can see here, it roughly runs along McDowell Road between Dysart and Pebble Creek Parkway, extending south as it crosses I-10 to Estrella Parkway to, I believe that's Buckeye, and then up Litchfield and over to Dysart. So it really serves some of the shopping centers, again, the proposed mall, some residential and historic Goodyear. This route is approximately a 10-mile route, and as you can see here, the costs that were assumed from the Southwest Circulator study, it's about just about $1 million for it to operate, and this is an annual operations cost, and this includes everything from fuel to the vehicle maintenance, to drivers, to administration. There are several costs that are rolled into this. In addition, of course, when you start a new service, you need to have buses to actually operate. So the estimate that came out of the study was just about $465,000, and these assumed, if you remember the Zoom circulator, it's those typical similar types of vehicles. So the 12-passenger, almost kind of like the dial ride vehicles that could operate in the system. Now, those are actually recommended as part of this study because you're trying to build ridership on the system. We're not going to pack the buses all at once, but you're hoping to have kind of a low level of investment with some new vehicles to actually build the service. And I think that's everything I have on the Southwest Transit Study.
One thing with some of the transit is the advertising. I know first the light rail, they weren't going to sell advertising. Now they're wrapped. And what type of advertising, is that something that could defray the cost? I mean, I assume once the mall comes, and how much does that go for?
Go ahead, Paul.
Council member, the advertising is a source of revenue for both the light rail and the bus system. In fact, a lot of cities also use that to help support their bus stops and their shelters. In terms of magnitude, for the region, it could be $2 to $3 million, I think. I mean, that's total. So, I mean, what you do for a circulator with 6 buses, while it would bring in some revenue, I don't want to overpromise, but maybe, I don't even want to guess, but for 700 buses and all the light rail, we're talking $2 to $3 million in revenue. I mean, it's a good number, but you'll see in the funding discussion that it's really a drop in the bucket in the bigger picture.
Okay, that's a good segue to you, Paul.
Okay, thank you. I want to touch a little bit on some of the funding revenues regionally. These are not necessarily specific to Goodyear, but just the way transit is funded in the region. And I'll start kind of on the lower left side. Local taxes, sales taxes, and general fund. There are several cities that have used general fund money, cities that have dedicated transportation taxes, some of which may be used for transit, and some cities have dedicated taxes for public transit. And we'll talk a little bit about that. I have a chart that shows some of those. but that is a key source of funding for the system. The second box, the regional sources, we have Prop 400. That's the half-cent transportation excise tax, of which 1/3 comes to Valley Metro for public transit. The other 2/3 is used for freeway and arterial improvements, but the 1/3 comes to Valley Metro. We also have some lottery funds. These are what used to be known as LTAF 2 until the legislature eliminated the Local Transportation Assistance Fund. So to not confuse people, we just call them the lottery funds. They were restored to us by a court order. And so that court order will continue until the legislature decides to do something about it.
And how much was that?
The lottery funds, we receive about $11.2 million per year, and we distribute that to the cities based on population.
And
Right.
how long have you been doing that?
That was restored in fiscal year 12, so we've had two years of distributions back to the cities now. So we're in our third year. The third main source of funding is from federal sources, and the MAP 21, the transportation bill, has lots of different programs for various uses. Mostly, I would say they're for capital uses, but there are some programs that allow the agency to use federal funds for operating assistance. And in particular, in smaller urbanized areas, we're allowed to use federal funds for operating assistance, and I'll talk a little bit about that. Again, advertising is another source of revenue, and then the last key source is fare box revenue. And just to give a general feeling, right now, or I should say in fiscal year 13, our preliminary numbers showed that our light rail fare recovery, which is fare revenues as a percentage of the operating and maintenance cost, for light rail was about 45%. For the fixed route bus system, it was about 21%. And for the paratransit, which includes dial-a-ride, ADA, and all of our alternatives, it was about 6%. So you can see, I mean, it does generate a fair amount of revenue for us. In terms of actual dollar amounts for fiscal year 13, the total pot for the region, and this includes everything the city of Phoenix spends, what Valley Metro spends, what all of the cities spend, we estimate at about just over $600 million for both capital and operations. About 37% of that came from federal sources, 45% came from local sources, and about 18% from the regional sources. And these numbers, I believe, are net of fares. Is that correct? Yeah. So these are just the local the subsidies needed from the tax sources. In terms of what was spent in Goodyear for the routes that Darren discussed, the total is about just over $200,000. About 90% of that came from regional sources, and about 10% from local, from the city of Goodyear.
That pie chart looks awfully small, and that little sliver out of there. I'd give a bigger one when I baked a pie than that. So how do we increase that?
Mayor, I think that's part of the discussion later. This is just kind of a summary of where some of the local funds come from. This excludes the regional funds, the lottery funds, anything from Prop 400, excludes federal. We're just looking at what some of the local funding sources are and which cities provide those. So you can see some of the big ones. City of Phoenix has a dedicated transit sales tax. It's 0.4 cents. And on fixed route bus operations, they spent about just over $141 million. Tempe is another one that has a dedicated transit sales tax. It's a 0.5 cents. They spent $23 million. Glendale has a transportation tax. Peoria has a transportation tax, as does Scottsdale. They spend a portion of those on transit. And Mesa has what they call their quality of life tax. And then Avondale, their capital improvement program tax. So you can see some of the numbers from some of the cities. This is what provides really the bulk of the transit service, the basic transit service in the valley.
Joe?
I'm not familiar with Avondale. Is that the 0.5 cent, that capital tax? 0.5 cent on their sales tax?
Vice Mayor, I
For transportation?
have to admit, I don't know offhand what the rate is on that. I could certainly find out and let you know.
Yeah, I was curious. You think it's...
tax that they raised about 10 years ago? Is that what you're talking about?
No, I'm talking about the one they use for transportation.
Yeah, I know they went to the voters about roughly 10 years ago for a public safety tax that was supposed to go to the police and fire departments to allow them to expand their services. So I don't recall them having a capital improvement program tax. I think they've got a public safety, and they may just take it out of there.
Here we go.
But
Oh, here we have
yeah,
somebody
getting that
an-
info
we
would be
have someone
helpful.
to answer that. Chris is great.
Mayor and council, the way the Avondale tax works is they have authority to take a percentage from their CIP to pay for transit. Councilmember Stipp is correct. That kind of came up when they introduced the public safety tax, but it didn't actually get introduced as a proposition until another ballot initiative a year or two later, where they also tried to increase the percentage for their auto mall area, and they asked the voters if they would authorize that a percentage of the CIP fund be put toward transit. To date, they have not utilized that funding source. They've just used general fund, but we can get you the information on what exactly that percentage is.
Thank you.
Hang on. The wheels are turning very slowly, but I know there's a question in there. So they have the authority to use their capital improvement fund money. So it's not really a tax.
A percentage, yes.
I think the other thing that I would like to know is, and it may be impossible to find out, but I'm looking at the way we fund our capital improvement program, typically with one-time monies. I'd like to know if they use one-time money,
Okay.
and based on what we're seeing building-wise, I can't imagine where it's coming from. And I don't mean that derogatorily. It's just I know what our construction sales tax is. So I'd be curious what that funding source is for their CIP as well, not just a percentage.
We can get that information, Councilmember Stipp. The other thing they have to do is if they plan to use those funds, they have to bring that to council for authorization. So yes, we can get that information for you.
Okay, thanks.
Go ahead.
Okay, thank you. As I mentioned, there's some federal money that can be used for operating expenses. So I wanted to touch a little bit on the Avondale-Goodyear urbanized area. It was recently expanded a little through the 2010 census, but the urbanized area is still under 200,000 in population, and so that threshold kind of is what the Federal Transit Administration uses to distinguish a smaller urbanized area from a large one. And the smaller urbanized areas can use their federal formula money for operating support and also for capital. But allowing the operating expenses is a key difference for a small urbanized area. There is a local match required. There's always a match required with federal funds. For capital, the federal funding will pay for 80% and the local is 20%. And for operating, the federal funds can go up to 50% with a 50%, so a one-to-one match for operating expenses. The apportionment to the Avondale-Goodyear UZA in federal fiscal year 13, we don't know what 14 is yet, but for 13 it was approximately $2.9 million. And just so you know where we've allocated those, the service expansion that Darren talked about on Route 3 is going to take about $326,000 of that, and about 8,000, because I think it operates on the border for a short amount. About 8,000 of that is in Goodyear. The Route 17 extension and increased frequency is about 620,000, of which about 315,000 is in Goodyear. The Avondale Zoom will use approximately 475,000. Then the remainder of the 2.9 million will be using to match expansion and replacement fleet to pay for, well, the expanded service, and then also there's just a continual replacement cycle for the fleet.
Joe?
Just in summary, I see a lot of different numbers out there, but for these different routes and these expansions, what kind of money would total city have to kick in for operation and capital?
But Vice Mayor, for these particular routes, these expansions, I should have mentioned that the local share, the local match is coming out of, well, for the Route 3 and Route 17, the local share is coming out of Prop 400. The regional public transportation fund is, which funds the current service on Route 3 and 17. That's being used as the match. Avondale has its own local funds to match for the Zoom, and then the region is also funding the local match on the expansion fleet that's programmed. So the city that does not have to come up with any funds for those at this time.
Joe? I'm sorry, Bill? You have to do it again.
So we're using Prop 400 money for the $323,000. I'm adding the 8,000 and the 315 together for the extension of those two.
Councilmember Stipp, that's correct, yes.
Okay, so when, and who decides that Prop 400 is going to be using that, or we're going to be using Prop 400 to do that? Is that a RPTA
Yes.
discussion?
Yes.
So the RPTA board could effectively at some point change their mind and decide to use that money for something else?
In theory, yes. The board could do.
Unlikely, but
It's unlikely because I mean it's being used to match federal money. It's a good use of our Prop 400 resources to expand service that's needed in the Southwest Valley.
okay. But in a contingency format, if that were to dry up, we either lose those routes or we got to come up with 400 or 323,000 on our own.
Yes.
So somewhere in this discussion, I think we need to keep in mind that we've got a liability hanging out there because it's not guaranteed. It's not a guaranteed. I mean, it is, but it isn't. So I hate to throw that out there. And I'm just assuming that's going to continue on really for the foreseeable future.
Yes.
Assuming it all goes well, I'm going to flip my coin now and go the other way.
Assuming Congress appropriates funds and we continue to get federal money, and tax revenues continue to come in at, we're up about 7% this year over last year. So assuming things go as we expect, I wouldn't, and ridership is built on those routes, I wouldn't see any reason to recommend changing that.
Or to think that they would go away.
Right.
Okay.
Right.
Go ahead.
This last slide will take a little explaining. This is kind of a pyramid that we developed to show a relationship between different types of service that we provide and the cost per passenger, the cost per trip for those services. And really, the highest level at the top are the most dependent or the passengers with the most specialized types of needs. Down at the bottom are our general passengers, fixed route services, which provides really the base of what we provide. Last year, for instance, total ridership was about 75 million. Fixed route between bus and rail was about 73 million of it. Van pool program was about another million. So all of the other alternatives, the ADA, the non-ADA, all of our taxi programs was about 1 million passengers, just to give some perspective on the total passengers. But let me back up a little, provide a quick differentiation between ADA service and non-ADA service, just so everybody's clear. And you may be already, but just I want to put it out there. The Americans with Disabilities Act requires that anywhere we put out local fixed route service, which includes local bus, circulator, light rail, but does not include commuter type peak hour service like expresses. So anywhere we have the local fixed route, we must provide a complimentary paratransit service for those who cannot use the fixed route. And it has to be for people within 3/4 of a mile of that fixed route. So that is a specific legal requirement. So anytime we add service, anytime we expand our fixed route services out to new areas, we open up a new service area for potential ADA riders. We don't know who will use it, but it's a legal requirement that we have to provide them service. Non-ADA is anything that's not federally required, and it's really voluntary. A lot of cities will provide other types of paratransit service to seniors, to other persons with disabilities who aren't ADA certified. And that's really voluntary. And so the moving from the bottom, the volunteer driver program, kind of the next three are really more suitable for non-ADA, for those voluntary types of services, and then the top two are more, well, they can do non-ADA, but really are more for ADA. So let me just touch a little. The volunteer driver program, I don't know that we have any in the region right now. The best example was the Sun Cities Area Transit that used to operate. You know, they paid for, the fuel, insurance, the maintenance, but because they used the volunteer drivers, which is a huge expense for most cities or for most agencies, you can see that drives their average cost per trip down. So the fixed route were at about $3.23. The volunteer driver program was at about $3.88. So it's a lower cost, but it's obviously a difficult program to manage because you're relying on volunteers. The next one up that's a little more expensive, at about $9.83 a trip, are cab coupons. They may be used for medical trips. An example would be the Ride Choice program that we offer in the East Valley for the cities of Mesa, Chandler, Gilbert, and Tempe. Those residents, and the cities pay for this, the residents can use, let's say for a dialysis trip, they can get a free trip that we pay for and don't cost to them, to the nearest dialysis center. They can't pick, I like the Mayo Clinic, and so we're not going to take them all the way there. It's to the nearest center. So there are some restrictions, but it is a free trip to them. So it's a little more of a cost because we're paying the full amount. The taxi voucher system really provides a voucher to the passenger. An example would be the Cab Connection program in the city of Scottsdale. The city of Scottsdale will pay up to 80% of the trip, of the taxi cost. And so they allow longer trips, they allow different trip purposes, so you can see the cost goes up a little. So it's a little more expensive. But those are flexible, they're entirely voluntary, and you can design a program to meet your needs. The next two, which we've used for our ADA, the required service, one's a taxi model where we hire a taxi cab, and this is what we're doing in the East Valley right now. We hire a taxi cab company who has already hundreds of cabs on the road, and they will provide the trips, and we pay them just for the trips they provide, from the time they pick up a passenger to when they drop them off, and then the cab is free to do other cab business. The top level is the ADA Paratransit, what we've traditionally provided through our dial-a-ride model, where we hire the drivers, we buy the vehicles. So we have to have drivers out there, and if they're not working doing a dial-a-ride trip, we're still paying them. They don't go off and do taxi trips. So it's a much more expensive way to provide the service. Now, the caution I will throw out there is that with the taxi service, because it's no longer a shared ride like the dial-a-ride, with the dial-a-ride, if Mrs. Jones calls up and says, I want to be picked up at 10, and a mile away Mr. Smith says, I want to be picked up at 10, we could pick her up at 10 and Mr. Smith at 10:15, and we may pick up or drop off several other people before they get to their destination. But with the taxi, they call up, cab's there, they don't share the trip, it takes them right to their destination. So even though it's a lower cost per trip, what we've seen in the East Valley when we moved to the taxi model is they're just using it a lot more. So our total cost for the program is about the same as it was, but we're serving 20% more trips. So it's just something to consider that because it's a better service from the customer's perspective. It's cheaper for us per trip, but it gets used more. So that's kind of the hierarchy. And again, the strict dial-a-ride ADA paratransit method of providing the service is the most expensive per trip. But again, the key point I wanted to make is anytime you expand to new areas, you're opening up additional exposure to new ADA trips that we can't deny. We have to provide those services.
Can I ask a question?
Yeah, just look at me and ask,
I'm
Ms.
sorry.
Molly.
Okay, thank you. I have a question on the cab coupon. You said we pay for it? Valley Metro was paying for that?
Councilmember Campbell, no, not we as in Valley Metro. We as in the agency providing the service. In the case of the the cab coupon in Scottsdale. It's the city of Scottsdale.
Oh,
I mean,
well, you were saying it was in all the East Valley.
Yes, and the East
I got
Valley,
it wrong.
the East Valley cities pay for it.
Pay for it.
It
Okay,
was a
I'm
general
sorry, I
we meaning.
misunderstood.
It was a
Okay.
general we meaning the public agency as opposed to the passenger.
Okay, so if we decided as a city that we wanted ADA paratransit, we would have to say it was going to cost us $36.77 per person to ride it.
In general, if you use the dial-a-ride model, which is the shared ride where we hire it's going to run roughly that per trip. It is the most expensive way to provide those ADA services.
Okay.
So
And-
basically saying the cab coupon service is
Well,
better.
yeah, but can a cab, do they have cabs with lifts that can take wheelchairs on them? And that's
Yes.
what I want to know.
Yes, the cab companies have vehicles that are specific to any purpose.
You've got these little cabs that are green now, and they're little bitty, and you can't get a wheelchair in there.
Well, correct. The cab company wouldn't send that vehicle to somebody who is in a wheelchair, for instance. They have specific vehicles, wheelchair accessible.
Just saw it at Starbucks the other morning.
Huh?
Just saw one at Starbucks the other morning.
Okay. Oh, could I ask a question about the Zoom? Are those buses ADA accessible?
Yes. Yes. All vehicles that we purchase have to
My
be
husband
have to
now
be
uses
accessible.
a scooter, and we have come across some public transit that we've not been able to utilize in a different town because they were not, and that's why I'm asking. So, I've never been on a Zoom. Where'd you go?
Go ahead.
It doesn't go anywhere.
Any other questions? Any other?
Questions of Valley, they're going to be still here, so
Okay,
they'll
all right,
be involved
all
in the
right.
discussion.
All right.
To continue on with taking a look at the digital marquee revenues, we try to break it up in one-time and ongoing revenue. So as you can see from the middle column, the one-time revenue is what the contractual obligation was to make a payment to the city in the amount of $500,000. LTAF 2 funds, we've shown them also. That's a 2-year accumulation of funds that are these funds are available for transit purposes only. So the total of one-time monies that we have currently is $883,987. The next column is the ongoing. The marquee revenue is $7,700 per month. So for the time that the marquee, this is one marquee, this is at the Park and Ride, that has been in service, it's accumulated $38,750 as of the current balance. LTAF 2, the ongoing, is approximately $191,000 a year that we're eligible. That's our share of the lottery monies, as was discussed before. So the total ongoing revenue stream that we would have from this source would be $228,750. If you add in the additional marquee, there would be an ongoing revenue of an additional $38,750. The circulator route costs that were shown before have been repeated here also. So the one-time revenues that would be necessary to purchase the 6 buses, as was mentioned, was $465,000, and the ongoing expenses would require roughly $1 million a year.
Joe?
Did you say the marquee is bringing in $7,000 a month?
Each, yes.
So that would give us $85,000 at the beginning of a fiscal year for the marquee. And what did you say the LTAF 2 annually would be?
191.
Regularly, 191 each
Right.
fiscal year. So you got 191 plus about 84,000. So you got about 270,000, not 229.
That's correct. The 38,000 represents only 5 months
Right.
of revenue.
Okay.
Thank you.
So we're looking at what, that 85, and we're looking at about 270,000, 280,000, something like that.
That's correct.
Bob, you said, though, that revenue source is for both marquees, not for the
No,
single.
that is just one.
Just the one?
That's the one
Okay.
at the Park and Ride.
So you could get 360, 355, whatever it is, if you throw the other one in there.
That's correct.
Bill?
Okay, so if we take, and I just used $1 million because it was easy to do the math that way. With a taxi voucher at 2620, that is 38,167 trips for $1 million. If we use the regular taxi voucher at 1731, that's 57,000 trips for $1 million. So we're talking about a very small little circulator route for $1 million, and yeah, I'm concerned about the route. I'm concerned about ridership. We have no idea. We're talking a lot of money for something that we have zero historical data on. And I'm just cautioning my fellow council members that we should be careful about biting off more than we can chew until we know exactly what our ridership looks like.
Although I do think that you have to have some preparation idea to know what it is, and timing. Housing market's increasing. Mall will be done probably October 2016. So do we wait till it happens and then backpedal, or do we start it now? And maybe what we need is a little bit more research from the public, put it out to the public as to number of people that feel that they really need transportation. We have a new grocery store going in, a large one that would warrant people getting to it. That's just some of my opinion. Sherry, go ahead.
I'd have to say, I've lived here since the 70s, not in Goodyear, but in the Valley, and the big hit on Phoenix, the whole Valley, everyone, is our transportation plans. We wait until something comes and then we build. That's why the 303 is not done. That's why, you can't get anywhere in this town. And commuter rail isn't going to come out here anytime soon. We may need it. We may need light rail. We're not getting it anytime soon.
Not. I can tell you that from my MAG meetings, so might as well forget that.
I would love it. I would
time.
write it in a second. But I think when you look at the circulators, they've worked well in downtown Phoenix for years, in Tempe, Glendale, Avondale. I don't know, maybe we can tinker with the number of trips until the mall gets here, but I think if we wait until after the mall's here, we have the same problem. We're going to be continuously playing catch up. And I don't know if cutting the trips or changing the route a little would save some money until we do get more there. But, Glendale has a circulator that does go from Westgate, at least during baseball season, to the stadium. There's a bus that's taking people back and forth, and I've seen it. And then that place, there's people there. That's one of the hits why people don't want to come to our stadium too. Mm-hmm. Is you can't get anywhere, and if you leave and you want to go to a restaurant, then you got to drive back. I think that could increase. I don't think we just jump right in. I think we need to plan it and figure alternatives. But I really think this is a good thing to look at for the future. And I think we have to look for the future because that's going to spur development. We have a university corridor we want to bring online, and I think that can be a selling point as we try to sell some of those areas to developers and to bring things out there to say, hey, look, we have a way you can get people there.
If you can remember when the Zoom came out, what was the biggest questions that everybody came to? How many calls did you get out? I got a lot of them. How many council people came to the council and said, how come they can do it and we can't do it? I mean, these are the questions that were brought before us and from our constituents and us on the council. I remember the conversation. I'm going to go to Cheryl Lynn first. Cheryl Lynn?
Well, I just wanted to comment. Historically, this area has been very receptive to the bus and bus service, and that was despite the fact at one point we had a very high ridership, astounded the people at Valley Metro because of the ridership that we did have. And that, again, at one point, that route was a 70-minute route. So if we're offering a 30-minute route, I'm not going to say build it and they will come, but I think historically this community has demonstrated that if there is this service, they will take advantage of it.
Joe?
If you use both marquees, you still have to find general fund money. If the 988 is the cost of about $630,000 to $700,000. The question I have, first of all, again, feel comfortable it's going to be used. But second, it's cost. I mean, in today's society, what are we giving up for the $700,000? Because you have limited funds from your general fund. So if we allocate $700,000 to this, what are you giving up for the $700,000? And then are you going to, I mean, what kind of evidence you have? And again, Sean may be right, but again, when I look at it, the numbers, because of the money, it's not we have unlimited resources. If you take $700,000 out of the general fund, what are you going to cut in its place? So I'd like to have all of that kind of thrown out there before I'm willing to make any decision.
Well, I think that's any project we do. I mean, I don't think
just wanna
your
make sure
I don't think your
I'm on
question's any different than every time a project's brought before us. The reason this is brought before us because there was a request, and because there was interest in the community. So yeah, Bob, go ahead.
Yeah, I don't want to mischaracterize this. This is not a recommendation for you to consider. We're simply trying to put this out there to display what the current revenues are, give you an accurate picture of what we've accumulated to this point, and what the costs are comparison to what the expenses are. We are there's various options. We'll get to the next slide, but it could be banked right now.
That's right.
It's something that you could accumulate a fund reserve for capital expenditures when and if that, or when the circulator route is deemed necessary. So if you would indulge me, I'll move to the last slide. And
We will indulge you. We'll be quiet so that you can get to that slide. Go ahead.
The first thought here that we came up with was to establish a pilot route, very similar to as a seasonal route for spring training. It could partner with the restaurants and the ballparks, the ball teams, restaurant, and it kind of demonstrate the ability and the potential use of transit in this community. It shows a different type of transit that might be very appealing to a certain them. And it does allow for advertisements, partnerships where you could get the supporting facility, the supporting restaurants, and hopefully the teams might have some involvement, and the city would all partner together. The second would be to commence planning and an implementation of this. What we have ongoing with the general plan, the subcommittee that's handling the transportation, they're looking at transit. That group has begun to look at some of these opportunities and where they would recommend transit be considered in the future. It could be an extension. It could be a nucleus of a group that might be able to help us poll the community or really bring out those kind of issues, what the community really wants for transit in this area. And then finally, another option is a technical advisory committee where they would really work on developing the needs. Is there interests? What types of purposes for transit are out in our community from our citizens? And then bring back to council and with staff assist in putting together a set of recommendations. Carefully giving them guidelines as far as what the expectation is. We don't want them to come back and design a full-blown transit system, but we really want to have them be the ears of the community to really provide that feedback to you to help you with the decisions on what's the appropriate next step.
I think I like Citizens Committee on that. I think the city center and how much information. At the same time, I'd like to, in my view, to run in our publications asking people to contact us, either through the website or phone or whatever, to let us know the interest level so it can build that up. But I think if we wait and don't start at least a small area in developing this, then and what we you have to decide you're going to keep holding this money back until you have that time that you're going to put this forth. But my personal opinion, we need to at least start at the beginning, take the baby steps on this. Wally?
My question is, we haven't decided to use the money from both marquees. That wasn't part of the deal. It was just one is dedicated to transportation. Am I correct?
Yes,
and
you
the
are.
council has not decided to do that. So we're only talking about one sign, and we can only spend that money on something that has to do with transportation. Is that correct?
The park and ride sign is the one sign that they have, the marquee has been designated. Those revenues must be used for transit.
Okay. And my second question is, or not really question, but I do agree with Bill. We don't know what our ridership is. And we don't have a downtown. So we can't take people to downtown Goodyear. We can take them from the ballpark down Pebble Creek Parkway to what? To Walmart? Supercenter? To a restaurant?
That's where the
Yeah.
the microbrewery's going. I mean,
When?
not right now, I think.
Well, I don't think it's going to be that far off. They're making arrangements now.
Are they?
Yeah, I don't know if we want to, is that out? to have
No, I just wondered.
Okay.
Yeah. And this is using a Zoom bus. And how big is this Zoom bus? How many people can get on it?
I think they said 11, but 12,
Well, we can't
12
move
people.
11 baseball people around. That's. I don't think that's. I think we're shooting ourselves in the foot if we do a Zoom bus with 12 people on it. And here we're taking it to spring training. We can't even tell people, park your car, we'll take you to the ballpark.
Well,
'Cause
if we
can
get
only
a
put 12 on
committee,
it.
if we get a citizens committee that will study this and look into this and find out the needs, that will answer some of our doubts and our questions. And, it's like the ballpark. Some of us had the opinion that we don't want to build a ballpark.
Right, I was
All
one
right?
of them. Yeah.
When you took it out to the public, what was the answer?
They wanted
Build
it.
the ballpark. Well, it's the same thing on this. I think we got to give our citizens the opportunity to weigh in on this. So I think that the least we should be doing on this is having a citizens committee to look into this along with the other things that we have. Bill?
I can support a feasibility study, but purchasing a bus and taking it for a ride, it does not, in my mind, doesn't make a lot of good fiscal sense right now. Study it and let's figure it out. I think eventually we're going to need it, and moving folks throughout the community, both here and in our neighboring communities, down the McDowell Road corridor, down the Pebble Creek Parkway or Estrella Parkway corridor, that makes a lot of sense. And I mentioned this during the presentation that we had months ago. The circulator route that still is on this map runs through cotton fields and past maybe one housing development. So even the current route that we have isn't real attractive. If there was some way, and while we've got this huge diversity in our community of needs, all the busing never goes north of McDowell.
Yeah.
So if you get up to Indian School, Palm Valley, the multiple phases that are up there, the little section that I live in, we don't have any public transportation. So I can't even suggest to my kids to learn how to use public transportation because they're nowhere near it. So I think studying this and looking at options on how to get busing, and I hate to use busing but how to get it introduced into our community, into our society may be very helpful. So study it. I'm with you 100%. But I really don't want to see us buying buses right now and getting ready for something and especially a 12-seater.
Well, I don't think we're ready. I don't think we're at that point. If they gave the impression, I don't think that's the impression you wanted to give. So I want to clear that with the listening public. That was not the goal of this evening, but it was to start the discussion. And I have to agree with you, Bill. I look at the retirement homes that are opening up now on Indian School, and if you talk about need, the north side has the greatest need of people who probably will not be driving. And soon many of our cars are going to be taken away from us, so we'll have golf carts. So I'm speaking for those people I do think we need to be looking into that a little bit more on the route. I was the same way you were when I looked at the route, and I went along with it, but did I want that? Would I finally say that's the route? No. Sherry?
Yeah, and I don't think anybody was suggesting go buy a bus tomorrow. I think we need to figure out what we need, look at the plan when we talk to the developers for the mall, find out what's going on. I live south of, you want to talk about no transit? Really? Up in Australia, we're on horse and buggy still. So,
See, and that's another need.
we
Up-
have
get
a
up the
retirement
hill.
community up
Yeah.
there. We do, and it's growing. They sell a lot of houses, and we do have a lot of older people that have bought houses up there as well. I like the fact, and again, this is all for study. I like getting the citizens involved because we got to know what they want. I think we all know we need transit. We just got to figure out exactly the best way to do this because the hospitals, the medical, we've got to get a way to get this. Should we tie in, link our routes to Avondale's or how do we want to do this? And I think there's a lot of questions. I think it's a good idea, a good start. I don't think we just implement it right away. And I think we need to look at just adjusting the route, change the price, or the buses are 2 big buses as opposed to 6 little buses, how are we going to
And
do
the
that?
teens up there don't have a way to get down. If you don't drive, you don't get down. Or
Yeah,
if your
there's-
parents, So getting the Estrella community and the teenagers to be able to down and participate at our Y or participate at shopping or whatever, they need to be moved back and forth. So I think the need is great, but it's going to be slowly developed.
Yeah,
And there's going to be spaces between some of the need.
And we're not going
It's
to-
not going to be continuous.
And I don't think we are. I think it's going to be a long time before there's the mass transit up there or the bus service up there. But something like this actually that would stop at the stadium and link in with other people, you could drive part of the way down the hill where there's not a lot of traffic, where you may be more comfortable. And Estrella, it's getting crowded there, and some people don't like to drive at night or something. So if you start to link these in, people may have to still drive, but drive less, which could be good too.
Bill?
We're in a work session, Brian. We can. You've got a staff committee, I think. I don't know how you a team put together to study the impacts of the mall. You've got something brewing with that, I believe, on a staff level.
Yes, council member, we actually have a couple of things going on. One is to look at the potential shoppers. So there's additional retail studies that are going on right now. The other is actually part of the transportation master plan. We're having the consultants look at the impact of the mall on the freeways, the freeway interchanges, all the other intersections, McDowell Road, for example. Looking back at the study that I think it was done by HDR some years ago, that was done back in the mid-2000s, 2007 perhaps. We're taking another look at that to see what impacts the mall will have based on newer information. That is going to drive, is there anything we need to do to those roadways in addition to, not even talking about transit, just will it be able to handle the traffic flows, and do we need to make any modifications?
Don't you also have a operational impact group working? I know you mentioned, the effects of police and fire and on finance, et cetera.
Correct. That's not formalized yet. There's some initial discussions, but you're exactly right. We want to be ahead of the game when the mall opens up. We want to know what impacts on public safety, what impacts on public works, really all the operations of the city. We know that there's revenues that'll be coming in from the mall, but at the same time, we also know that we have to use some of those to offset the additional cost for service. That has not been formalized. It's one that is going to be this fiscal year.
Okay. And the reason that I was driving toward that, sorry for the pun, in that direction was it may be a good idea for us to consider how quickly we could implement a Zoom-type circulator when the mall hits. How much lead time do we need? How much, to kind of be forward-thinking about it may take us a while. People may say, look, we want to have a bus that goes from Estrella all the way to Camelback. And that's great, and that we want to try to serve our citizens' need, but our major impact may be getting people to and from that mall. So how quickly can we stand up a Zoom-type bus and maybe make that part of that discussion so we at least have a plan in a folder that we can pull out and go, hey, it's going to take us 6 months to get a bus. Now's the time, council. I'm just, thinking what else we can do besides just a feasibility study for a smaller corridor that may not come to fruition when we've got this other need we need to we need to fit.
Mayor, Councilmember Stipp, to your point, and I think also to what Brian's talking about, and actually very much toward what Councilmember Campbell has already stated, you would not put a circulator on the street today and expect that you're going to get outstanding ridership. But what you do need to do to move in the direction, and as you said, Mayor, at our last meeting, continue the conversation about transit and to get more input from citizens about transit, is to plan. And in addition to some of the things Councilmember Loretano has said, where you see development coming, so you start thinking about these scenarios, where do you put it? We know we don't want it on Yuma. We've talked about Van Buren. I almost had a stroke when I heard Darren say Buckeye or Broadway. What a citizen committee does, and I'm certainly not advocating that, although it's a great idea, is they kind of hone the message for you. They give you that feedback from the citizens, from the neighbors in their community. The General Plan Committee has a subcommittee on the Transportation Master Plan. A lot of those folks have talked about transportation or transit, and you're going to see next week the Transportation Master Plan. The consultant is going to touch on transit again. We're at this really terrific nexus right now where you're going to get citizen satisfaction survey. You've got the General Plan Committee working. You've got the Transportation Master Plan, which will go to public meetings. This is probably the most dynamic time to have these conversations. For us to bring these guys in and tell you what the developments are, I can tell you Darren is on our General Plan Committee as a resident of Goodyear. Paul and I go back about 10 years when I was fighting, along with other staff, to make sure that Goodyear was in Prop 400 in some way, shape, or form. And then Jorge, you know, has worked on our Southwest Valley Transportation Study with so much passion. And Bob and I also go back to the START route, which I know Councilmember Holman is, it's just one of the most passionate causes she has ever worked for. And it dates back that long. So it's a process. It's going to mean more conversation, and it's going to mean more dialogue. We don't want to do this tomorrow, but the mall is such a dynamic motivator to plan this further that we want to continue to visit it with you, and this feedback has just been so tremendous tonight. It's the most we've ever gotten back. So no, we're not ready to jump in, both feet first, but we want to continue this dialogue. And thank you to Vice Mayor Pizzillo for providing our representation on Valley Metro's committee at RPTA, because he kind of keeps his finger on the pulse of how the money gets spent, and that's key for us. We want the money to be there.
He's on top of them.
Yeah, and Mayor, you're also going to start hearing conversations about Prop 500, the next proposition. These conversations have already started. So if we hear from you, from a citizen committee, on what the needs are in Goodyear, then we're going to be able to be at the table and say, no, the transportation doesn't stop at Litchfield Road. It goes to Pebble Creek Parkway. It goes to Canyon Trails.
If I don't have the information, and we don't have this talk here, I get to MAG, and let me tell you, there's competition there, and I'm with no information, no facts, no needs, because we said it's too early to start. I cannot think about this, do not want to spend the money. So that's the thing, Bill, that when you make statements like that, it just leaves up like this, okay? We need to know every bit of information we can get. And in the end, if you're right, it will tell that. Okay, so it's not about I'm right, you're wrong. It's about gathering this up, and I really need that because votes come up very quickly, and I want you to know that goes so fast. And you say, what happened? Well, what happened is I walked out with my pockets empty. That's how MAG works. So, I mean, you just have to be in tune, and I need all of this, and the city needs it to progress.
And I do want to
I have a question.
Yes,
I'm
Wally.
sorry, go ahead.
I have a question, please, Bob. Is the survey going on right now, and has the council seen the survey? Do we know what questions are being asked, and specifically, what is the transit question? Because I haven't seen anything, and I can't find anybody that's received the survey.
The survey hasn't gone out. I believe Romina was indicated that it was going out in February.
In February.
Excuse me, on the citizen satisfaction survey?
Yes.
Yes, actually, that was the only manager update I was going to provide today, so you're a little bit early, but let me go ahead and hit that while we're talking about it. We actually sent out postcards. They look just like this, and they went out to 3,000 homes, so it informs them about the upcoming survey, Get Your Citizen Satisfaction Survey, so it went out this past Friday. What it's doing is it's advising those recipients that they're going to get the actual survey on Friday, January 10th, and then there will also be a final mailing, additional mailing on Friday, January 17th. And the direction, of course, that we got from council was to hit 3,000 homes with those mailings for the surveys. In addition to the cards, and we certainly are using several venues to try and get the information out, Arizona Republic ran the mayor's column on Saturday in the Southwest Valley section that really promoted those citizens that got the card, get the survey, to turn them back in, the importance of that. And then, so we've also done myriad calls to the media. Posts are on Facebook, tweets are on Twitter. Mayor's column was also sent to local magazines. Webpage is being updated, and also, if for those citizens that want to read it in Spanish, that's available to them as well. And the 3,000 randomly selected households, the survey is going to focus on the three key areas, of which includes transit, by the way: quality of life, caliber of services residents receive, and the opinion of local government. So the results will be back to us in draft form by mid-March. By the time we get them back, by the time they're processed by our consulting team, we'll have those results back in mid-March.
Could we get a copy of the survey to see what questions are being asked, please?
Right. That's the same one we went through with council. We'll get that back out to you.
I never saw the survey.
It was on, they sent to us.
Well, the survey questions, yes, we actually brought before council in work session, and
Yeah,
we'll make
I saw that, but is that the ones we decided specifically to use?
right. And then, but we'll get that back out because now it's in final form. We're getting it in final form, so you have not seen the final form.
Okay.
Saw some of the questions that were leading up to it. Wanted to see how many open-ended questions, for example, some of those types of things. But now that it's been finalized, we'll get that to each of the council members.
Just curious to see how the transportation piece was formalized and what we're specifically, are we asking them, do you want bus service? I mean, if you're just saying, do you think we need more transportation, everybody's going to say yes. But what?
We'll get the specific questions to council.
Great.
And Mayor, if I could, I just want to thank these guys publicly for all the time that they've spent, not just on this presentation, but also on our prior studies, because we seem to keep hitting this crew, and they've really put so much into the Southwest Valley over the years that I just want to make sure we thank them, because that's exactly the kind of expertise and leadership we need in order to continue to be involved in this process.
Right, and I appreciate it. We are a very vocal council. So I don't know if you're used to this, but they really dissect everything. So that's good. And we have varying opinions. And I'm turning this over back to the city manager because I don't think he was done. Yes, go ahead.
Well, the one thing, just I know we're not voting tonight, but on the policy questions, my read of council, the direction is kill number one. We're not looking at a pilot route at this point to the ballpark. I'm hearing more of a direction of kind of a blend, well, at least number two, to coincide with some of our activities as the mall opens up, and the impacts on operations, which we can easily include this part of it as well. Question is that I wasn't sure that I got enough direction on, or we got enough direction on. Should there be a technical advisory committee or some type of citizen group that augments this, or is this something that we focus on number two as a staff-driven as we look at the opening of the mall?
Let's hear from the council because I don't know. Bill?
I think a technical committee of some sort is in order. And by technical, I assume we have resident and somebody who's smart about transportation on there.
I think we know people living in Goodyear that might be able to do that.
Yeah, and I think we can draw from the transportation committee that's been set up for the general plan, so we can probably just, rather than going through the process of getting a whole other committee, maybe use that and add to it.
Yeah, I think that's a good idea.
That's a good idea.
Joe?
Combination of 2 and 3.
Same. Wally?
Okay, I like 3 and 2, as long as we're not, I thought we were doing a feasibility study. I thought we were going to look into it. If we're going to commence planning, that means an awful lot of stuff's going to be going on, because we're going to be planning routes, and I think we're digging into more than what I thought we were going to do. So maybe I didn't listen hard enough. What did you hear?
Well, there was one change of that. That too specifically talks about a circulator route. We could leave it more broad to have it talk about additional transit services, not designate a circulator route.
And that's kind of where I was going with 2 and 3. If you're going to have this technical advisory committee, you got to include them all in that discussion. So it doesn't have to be a specific. Yeah, that's why I said the 2, the 3 combination doesn't have to be a specific to something. But yeah.
Sherilyn?
Yeah, I'd just like to put my 2 cents in,
Of course.
if you don't mind. I think it's very important that we do some planning. We need to know what is needed. We need to know what the tolerance of our population is to having a transportation tax. I mean, realistically, to have solid transportation, that if you look at the list of who has developed transportation in their community, there has been a self-imposed tax to make it happen. We need to know those things because, as you stated, Mayor Lord, that these things move very quickly, and you need the information at your fingertips to know where your community is needing to go. And if you don't have it, then you're left left back in the back. I've had that. We had that experience, and it is I will admit to you that it's an aged experience, but the experience was because we had done our homework and we knew we had done a survey of the area and we knew what the transportation needs were, what the destinations were. Was it medical? Was it work? Was it shopping? When 20 people, it was 18 people were called to the table with Maricopa County Social Services, we were the ones that had the answers, and the other 17 people had not done their homework. And hence we applied for and received the $200,000 grant that allowed us to have the START bus, which was the first transportation we had out here as a bus system since the 50s. It was a very small start, but it was a start. But I mean, my experience tells me, if you have not done your homework, if you don't know the answers, you are left not at the back of the bus, but off the bus. Right. So I think it's very important that we do look at this. I go along with the 2 and 3 as well, but I just cannot emphasize how important it is for us to have our homework done.
Yeah. And while you gather these people together, let's not waste their time to have to come back to them at a later date. So if they may extend this conversation beyond the 2 things you've given, but it's information, and that's what we're looking for, is information. So when we're looking at all 3 of these, you might ask them about the feasibility. Do you think we ought to do this? So let's get it all in on the committee. Let's put it out there and get their information. Let's not piecemeal this to the committee. Let's throw it out, get the information, which we can then.
That's why I was hoping the survey question was structured specifically instead of real general for transportation. That would have helped us a lot because there's 3,000 answers right there. But it's too late.
Well, let's let the committee define and bring it down before you do that. Yeah. I think that the questions that were sent out for a particular reason, and we designed them for that, if you remember, around the table. When you're going into another thing and you're bringing groups together, now you're defining areas that you want them to look in. I don't think at this time that we want to throw those questions out to the public that we've talked about today in this until we get the information back from the first one. Do you agree with that, or is that kind of what plan is?
No, that's exactly what we had envisioned in this process.
All right. Okay, so Wally, you want last word?
No, I don't want to have another word.
Okay.
I've had enough, thank you.
Okay.
Let the air out of your tires.
Oh my gosh, I'm going to catch a bus.
Are you Z'd out? Are we finished?
Yes.
Again? We want to thank you for being here. Because we know you're pulled all the time in transportation from all aspects of Maricopa County, probably. So we thank you and you can see we are interested, and you'll have to come back again, I'm sure. Okay? Thanks again.
Thank you.
Bob, thank you. Okay, city manager, you kind of, where are you on this?
There were a lot of dialogue tonight on the different work sessions, so those notes were taken. I won't go all the way back through those. The only thing in addition to the work session items for follow-up is we will get a copy of the survey, so you could, now that it's been finalized, so you'll see that. We'll get that out to you this week. That's the only follow-up.
The other thing, I don't know how we're going to do this, but I'm just going to put it around the table again. City manager sends a lot of emails out. Now, I know we get a lot of emails. I mean, I can be sitting in a meeting and I have 43 emails on there all of a sudden. But a lot of this information we're talking about, he sends it out in his little things, and it's up to us to try to retain that information. I know it's hard, but maybe we need to make some copies of that information. Maybe we need to highlight it on our, to go back and reread it or something, because as the one thing I have gathered in the council meeting throughout the year, that you're missing some of the information that has been sent to you. So we all need to do a better job as council people in being sure that we're reading that information. And I know we're busy, and it's hard to read your emails all the time and your Blackberries or whatever, but we need to do it, okay? Yes, Bill?
I'd just like to make a general observation about tonight. This is kind of one of our new work session formats, shorter presentation. I thought the dialogue was excellent. First time we've all had a chance to chat. So these last couple have been, I thought, very good. So I wanted to give some instant feedback. But I know personally I appreciated the very short presentation and all the dialogue.
Thank you, Bill. And I think the presentations were well done. They really were understandable. So anybody else, any comment? Okay, before I adjourn, just to remind you that the next meeting will be January 13th, starting with a work session at 4:30 and a regular meeting to follow. Okay? All right, meeting adjourned.
That's a big one.
Happy New Year, everyone.